here we are for our third mini lecture of our autonomic nervous system. We are going to exclusively look at the sympathetic division and discuss the different pathways that sympathetic neurons take as they approach their target organs. All right, so as we look at the sympathetic division of the autonomic nervous system, one thing that we'll notice is that all of the nerve fibers are going to actually arise from the thoracic and the lumbar regions. So here we have our pons and our medulla, our spinal cord coming all the way down. This would be the end of our spinal cord here. And you can see that we have starting at T1 through L2. That's going to be where we end up having fibers for this particular division of the nervous system arising. So each of these dots and red lines, so this represents like a neurosoma, and then this line outward is going to be the axon leaving the spinal cord and heading out towards the target organ. So all of the nerve fibers for the sympathetic division are going to arise in either the thoracic region or the lumbar region. So T1 through T12, and then L1 through L2 are going to be the origin points for all of our sympathetic nerve fibers. Our preganglionic neurosomas, so the cell bodies for our preganglionic neurons, are going to begin in the lateral horns and nearby gray matter of the spinal cord. So we're starting in those lateral horns. Again, if you think back to last week's lecture, I said that in particular regions of the spinal cord, we have lateral horns of gray matter. They are associated with the sympathetic division of the nervous system. So that's where we are with our cell bodies in those lateral horns and then leading out of the spinal cord. So the axons are going to lead to what are called sympathetic chain ganglia. And so alongside both sides of the vertebral column, we have sort of these longitudinal strings of ganglia. Right? So each of these sort of masses is going to represent a ganglia, and we can see that it runs all the way up one side and all the way up or down the other side. So longitudinally alongside the vertebral column, we have these chain of ganglia. Because of the way this works, what we end up with are very short preganglionic fibers. The ganglia themselves are going to be interconnected by nerve cords. So it's not like we have a ganglia here that's isolated from a ganglia here. These ganglia are all connected to each other, which is why they're sort of represented as one sort of lumpy unit here. That's because they are all sort of interconnected. The number of ganglia that we have person to person can vary. The sort of average number, if you will, would be 3 cervical ganglia. So 1, 2, and 3 would be cervical ganglia. And then we have 11 thoracic, which I'm not going to count to 11, but 11 thoracic, 4 lumbar, which would be down further this way. Oh, they kind of numbered them for us. 4, and then 4 sacral, and 4 in the coccygeal region, right? Now, one question that may come to mind is, why the heck do we have ganglia in the cervical regions, and why do we have them in the sacral and coccygeal regions when we don't have sympathetic nerve fibers coming from those regions of the spinal cord? And the answer is because the neurons that are arising, like in L2, can actually sort of take a turn and travel down to S1, S2, S3, or down to the coccygeal region. So they aren't necessarily isolated to just sort of their adjacent ganglia. They can move up or down into different levels of this chain. So that's why we have innervation to organs that come out of the cervical region or out of, say, the pelvic region, for example, may come down and travel through some of these lower ganglia. Excuse me. Okay, so what else did I need to say? Oh, in the sympathetic division, I want to sort of emphasize this first bullet point here. We have short preganglionic fibers. They're pretty much only going from the lateral horn into the associated ganglia, where they then synapse and then are going to head out to the target organ as a postganglionic fiber. So we have long postganglionic fibers and short preganglionic fibers. We're going to see that that is different when we move into the parasympathetic nervous system. So keep that in mind and pay attention to that difference. So in this division of the nervous system, each of these paravertebral ganglion is going to be connected to the spinal cord by two branches, which are called the communicating rami, or rami. So the preganglionic fibers, which are myelinated, are going to travel by way of the white communicating rami, and then the postganglionic fibers, which are leaving, are going to travel by way of the gray communicating ramus. Sorry, singular would be ramus. So here we're going to have that lateral horn, right? We see our fibers are moving out. They are going to go, because they're myelinated, so they would communicate via the white ramus. And then our postganglionic fibers, right, so here's that synapse, they're going to travel out towards the target organ through the spinal nerve as part of the gray communicating ramus. Right, so we have sort of different ways that, or different rami through which our preganglionic and postganglionic fibers are going to travel. After entering the sympathetic chain, so after entering these ganglion, the preganglionic fibers can follow three different routes. And so I would like you to maybe write this down. So this list is for preganglionic fibers. So I'm going to say this again. After entering the sympathetic chain, the preganglionic fibers can follow three different routes. One of those routes is that the preganglionic fiber is going to end in the ganglia that it encounters first, so in the ganglia at that level, and it's going to synapse, right? So this would be an example where we have our preganglionic fiber going into the ganglia of this chain, and it has options. It could continue on up, it could continue on down, or it can synapse in this associated ganglia. So it's going to actually synapse here. The preganglionic fiber at this point ends, the postganglionic fiber begins, and it can carry that information then out the spinal nerve to the target organ. The next thing that can happen is the preganglionic fiber can either travel up or down the chain and synapse at a different level. This is the only way for those cervical, sacral, or coccygeal regions to get input from the sympathetic nervous system, because they don't have sort of this direct association to the spinal cord, right? They don't have sympathetic fibers that come off of the cervical region and go straight to a ganglia. So if a ganglia in the cervical region is going to get any input, it has to come from one of the regions below. So for example, we can follow one of these other fibers, and we can see that, this one, for example, is going to go up to the next level, or this one is going to go down to the next level. And then in a different ganglia at a different level, it will synapse, and then that fiber will make its way to the target organ. Now the last option here isn't really shown, but we will again look at this on the next sort of slide. The last thing that can happen is our preganglionic fiber can pass through the chain without synapsing at all. So it would just keep going through that ganglia, and it would continue on as what's called a splanchnic nerve. And so again, I'm going to show you that in the next one, but these are simply going to be preganglionic fibers that do not synapse in the ganglia, but then actually hit a second set of ganglia sort of further out, and that's where they're going to do most of their business. So clearly associated with the routes that the preganglionic fibers take, now we're looking at the nerve fiber routes. So these are going to be nerve fibers that are actually leaving the sympathetic chain ganglia. And again, we have three ways. These three ways definitionally look very much the same as the three ways we just saw, but again, these are based on the nerve root of the nerves that are leaving the ganglia. So on the last slide, we were talking about preganglionic fibers coming into a ganglia. Now we're talking about what's happening coming out of the ganglia. So again, just like what we talked about, the first one is called the spinal nerve root. The spinal nerve root is going to be a nerve fiber that leaves by way of the gray ramus, returns to the spinal nerve, and then travels to the target organ. So here's our preganglionic fiber, which is going to go into the ganglia. In the ganglia, it is going to synapse. The spinal nerve, or the nerve fiber, is then going to leave by way of the gray ramus, return to the spinal nerve, and then go out to our effector. This is going to be really common with sweat glands, blood vessels of the skin and muscle, and other things like that. The next nerve fiber root is going to be the sympathetic nerve fiber, the sympathetic nerve root. So this is going to be a nerve fiber that leaves by way of sympathetic nerves that extend to heart, lungs, esophagus, thoracic blood vessels, and these are also going to be known to form what's called the carotid plexus, which sends effectors, or is going to go to the effectors of the head. So let me sort of explain that again. Sympathetic, we are going to here move up the chain and then out the spinal nerve. They're leaving by way of sympathetic nerves that extend to heart, lungs, esophagus, thoracic blood vessels, and they do form our carotid plexus. And so this image is actually not great because this image is showing us what's happening with the so this is telling us what's happening with the preganglionic fiber. So I would not necessarily, you could actually use this as sort of a better image than the last one for what's happening with our preganglionic route. Sorry. Okay. And then the last one, which is the last one I mentioned for our preganglionic fibers, but this is called the splanchnic nerve root. And so in this case, we're passing through the ganglia without synapsing. So we see that here's our preganglionic fiber, goes through our ganglia here. Right, here's our ganglia, so it goes through that without synapsing. And it actually continues as a, what's called the splanchnic nerve. So there's that word. And then leads to a second set of ganglia called collateral ganglia. So here's another ganglia which is further away from the spinal cord. It is going to be closer to the target organ, and it's called a collateral ganglia. So my apologies on this second one. I mean, you can see it, this image shows it better, right? So we move from T1 here up and then out as what are called sympathetic nerves. And then again, those sympathetic nerves are going to extend to heart, lung, esophagus, thoracic blood vessels, and form the carotid plexus, which has effectors in the head. Okay, so let's see. Okay. Oh, and I guess I should say for the splanchnic one, this is only going to occur with some of the fibers that arise between T5, so thoracic 5, and T12. The rest of them are not going to follow this particular route. All right, so I am going to stop here, come back with our next little mini lecture in a little bit.